Subscribe to our YouTube channel and don't forget to press the bell icon to get all the latest updates.
We are inside the district war room of Trivandrum district in Kerala. This place you see behind me, this handles the entire COVID crisis of this district. Here you can see these people. This is the desk 2 over here. If you could pan this side, this is the data entry people, and here this is the desk 1. Basically their main job is to attend calls, the distress call from COVID patients, arrange beds for them, to keep an eye on the availability of beds, the availability of oxygen, the ambulances and everyone. Now here we have Dr. Rakesh, who's the nodal officer of this district, and he's in touch with the other nodal officers of each institution. Here we have Dr. Arura. These two people are the brains behind this COVID war room, and they function day and night over here, and they are responsible for this entire district. Dr. Aruna, please come here, this side. Okay. Dr. Rakesh, first can you explain how does this war room work?
Basically, here calls are received from the different parts of Trivandrum district, from various persons, including health workers, from hospitals, and even directly from the patients. It will be either for shifting of a person to a hospital, or for clearing any doubt, also for teleconsultation.
Now if you could give us a tour of your war room. Let's proceed. We'll start from there. Just this side, please, ma'am. Ma'am, please, up here. Yes, sir. So, can you tell us what the team sitting over here? What is their function?
Yes. Here, these people, non-medical staffs deputed to the war room. They are deputed to handle the calls. They are trained to take the calls and solve the cases.
So they are not doctors, they are from the non-medical field, and they're here, they just attend the calls, the distress call they'll receive on the system, right?
Yes, they will register the cases, and they will hand it over the doctor's desk, and they will solve the cases.
Now, Dr. Aruna, I want to ask you, what sort of calls do we get over here, and the frequency of the calls?
It is like, we mainly get this shifting calls. Sometimes they call for like doctor's consultation also, and like we give them medical telecounseling. They consider about call about checking this vaccine availability. Mainly it is about shifting, and per day we get now around like 800 calls. During the surge it was like 1500.
When we talk about shifting, what are the challenges now during surge you said? So what are the challenges this war room has faced during the surge time in hunting for beds, in shifting patients? What was the scenario at that time?
It was like when the surge came, we like so many volunteers came up. So it was like a lot of help to us. Then also we maintained this connection with COVID nodal officers of private hospitals. They update this COVID Jagrada portal thrice a day. So we were able to get this bed vacancy and all. So when we receive a call, we will be checking with this bed availability, calling up the hospital, and they were all like getting empaneled in CASP, that is providing insurance for government patients. So we were like able to relocate patients somewhere like in private hospitals or government facilities according to their needs, and it was like all well managed then. We could sort out that.
Can you share some light on the workload during the surge and the scene now?
Yes, during the surge it was literally a war room. Several persons have come from different parts of the district to help us. The phones were constantly ringing. We used to get even every minute we get a call in a phone. We have to attend the call, solve the cases, categorize the patient, and to send the ambulance within 10 minutes. That was our target, and we have reached it. Almost we have completed it.
How difficult was it to handle an entire district at a time where the cases were at the peak?
Yes, it was too difficult at the early stages, but the district administration rose up to the time, and they helped us very well. They have converted many institutions as first line and second line centers, and also government given an order to every private hospital to reserve 50% of their entire bed to COVID patients, and in that 25% to government patients. So we are the person who are entrusted to give the Karunya Arogya Suraksha Pathadi caste beds to the needy patients.
Dr. Rakesh, tell me now from desk 1, you tell me that is the, if you can, the camera can show, ma'am, this side please, yeah. So, Dr. Rakesh, that's the desk 2, right?
Yes.
What is the function of the desk 2?
Same function.
Okay.
But the handlers are from the education department.
Okay. Why is that the education department over here and the non-medical staff over there?
In the earlier stages, the teachers are posted here because of all schools are closed.
Okay, those are the teachers on duty?
Right. Yes, now it's mixed up.
Okay, now it's mixed up.
Yeah.
So how many teachers we had in the war room?
We had around 20 teachers.
Okay.
20 teachers at the time.
Okay.
Now it has reduced to less than 10.
Okay. Now then from the desk 2, we we move on to the rapid response team over there, right?
Okay.
So what is the function of the rapid response team?
Rapid response team mainly consists of these doctors and interns on one side and motor vehicle department on the other side.
Okay.
So this doctors handle with this casualties, emergency cases like category C patients.
Okay.
So also when they are we were having a lot of cases, they used to handle those, and they used to like clear all the inquiries, attend medical telecounseling calls and all, and they handle over these cases to MVD, and category B, category A cases also were getting transferred, like shifting patients information were getting transferred to the MVD. This is motor vehicle department people. So they will be entering that in the spreadsheet.
So motor vehicle department, that means they handle the ambulances also?
Yeah, they handle the ambulances and they have this shield taxis. Okay. So they will be entering that in a spreadsheet that you can see there.
Okay.
This is a Google sheet shared to the DMO office also.
Okay.
Once they are entering that, DMO office will be assigning a vehicle.
Okay. Dr. Rakesh, yes, I want you to explain the screens which you see over there.
Okay, the first left side first screen is the COVID Jagrata portal screen, which shows the hospital bed vacancy status, oxygen status, all are there. The second and third is the ambulance team, their screen. Every calls are transferred to the respective taluks. And they will assign the ambulance from their taluk.
How difficult was it to get ambulances during the surge time?
It was a little bit difficult at that time, but still we managed it.
Still, Kerala tops the list of COVID cases in 22,000 per day in the entire state, and where we are standing right now, Trivandrum or Thiruvananthapuram as they call it, it is one of those districts with highest positivity rate, right?
Yes.
So, do you still feel the same workload as it was 2 months back?
No. I think the cases are still there, but the hospitalization has come to a little bit.
So there is a drop in hospitalization.
Yes.
So do you, does this war room even manage the quarantine centers?
We had, but more than 6 months it's not there.
Okay, so people are taking home quarantine.
Mainly home.
So the hospitalization has dropped. People are taking home quarantine, and now there is no chaos as it was maybe 2-3 months back.
Yes.
Yeah.
Yes.
Okay. These are screens. They tell you the availability of beds in both private and public hospitals, right? How many hospitals are attached to it?
Almost every private hospitals are attached, and 50% of the bed are reserved to.
Vacant in private hospitals.
Yes.
So do you also get calls like regarding bill payments and all, like if a private hospital is charging much higher rates than what they're supposed to charge?
Yes, the district administration has posted several sectoral magistrates to every private and public institutions for looking the complaints from the patient side.
Yes.
So if there any complaint rises about the bill, we will transfer the call and inform the respective magistrate, and they will solve the problems.
Okay. So how many such calls do we get in a day maybe?
At the time of surgery, we used to get at least one case a day.
Dr. Aruna, how many war rooms like this we have in our district, maybe Trivandrum district if you talk about?
There are several. Actually, this is the only war room. There are COVID control rooms.
Yeah.
One in the corporation office, and for several LSGDs, they have implemented this mechanism, so they could handle this like cases efficiently in their circle.
So does this war room also report to any other control room?
This, both to the district DMO, District Medical Officers Control Room, and also to the Directorate of Health Services, DHS Control Room.
Okay. So all these people, they are working in shifts. How many shifts?
Actually, they are working in 3 shifts.
Okay.
8 to 2, 2 to 8, and 8 to 8. Some people, including volunteers, there are volunteers still now. Still they are working. They stay back for 12 hours. In the surge time, they used to stay back for even 48 hours. Yeah.
Okay. Do we get calls related to mental health also, like post-COVID recoveries? The mental health counseling and all. Do we do that also?
Yes, we are receiving several calls, and we have a specialized psychological support team, and they will follow up them.
Where is the psychological team over there?
DMO side.
Okay, it's in the main head office.
Main head office.
Okay. So how many such calls we get a day?
Usually around 10 to 20. Yeah.
Okay, 10 to 12?
Yes.
Okay. So you see, this is the district war room of Trivandrum district. There are other war rooms also, but this is one of the main rooms, and it is directly connected to the head office, that is the district medical officer's office. Now you see, these are teachers who are, because the schools are shut, they're here on COVID duty. This is the center from where the entire district is managed, the availability of beds, the shifting of people from homes to hospitals or even the quarantine center. Now the one good thing is, though Kerala is leading with maximum number of COVID cases, there is less hospitalization and a lower death rate. That is something which you can feel good about it, and this is the result of the efforts put in by these people working over here in this war room. With Shiva Devnath, this is Nazia Sayed for Mojo Story, Trivandrum.
It's great to see you here. Thank you for watching our work. If you haven't subscribed yet, don't forget to click the bell icon and subscribe to Mojo Story and support independent, robust journalism.